Hi and welcome back to my channel. If you're new here, my name is Dr. Latrice Montgomery, and the purpose of this channel is to discuss marijuana from a scientific perspective. So let's go ahead and jump right in. Now, as many of you may know, marijuana is legal for medical purposes in 33 states and is legal for recreational purposes in 11 states. And Ohio just happens to be one of those states where marijuana is legal for medical purposes. And given that the Ohio Medical Marijuana Control Program has been fully operational for about a year, I thought I would provide an overview of the program as well as a few updates. So that will be the focus of our time together today. And as always, if you have questions or comments or ideas for future videos, please feel free to leave it down in the comments below. So let's jump in. In September of 2016, Governor John Kasich signed House Bill 523, which allowed for the use of medical marijuana for certain medical conditions. And of course, this bill also stated that there needed to be a program established to help oversee this process. As you might imagine, distributing medical marijuana to patients is a huge undertaking. There are many issues to consider. So what I hope to do today is provide a behind the scenes of the Ohio Medical Marijuana Control Program, just to give you an overview and also just a few perhaps fun facts that you may not have known. So let's go ahead. The first question is, who oversees the Ohio Medical Marijuana Control Program? And the answer to that is that there are many stakeholders involved. One is the Department of Commerce. Their job is to oversee the cultivators, the processors, and the testing laboratories that are associated with the program. And then there's the State Medical Board of Ohio, and their job is to oversee the physicians who all have certificates to recommend medical marijuana. And also, they approve the conditions for which medical marijuana can be used in Ohio. So right now, there are 21 approved conditions, and I'll include a link below that will show you what all of those conditions are. There's also the State Board of Pharmacy, and their job is to oversee the dispensaries, as well as the patient and caregiver registry. They're also responsible for putting together the rules around the forms and methods of marijuana administration, as well as overseeing the Medical Marijuana Advisory Committee, which is essentially the public face of the medical marijuana program. Also, there's local government, and they can make decisions such as where should dispensaries be located and can it be located within certain areas of the state. So again, as I mentioned, they all play a unique role in overseeing the entire program. And so what I'm going to talk about next is what happens at each of these levels and how medical marijuana ends up in the hands of patients. So, back to the cultivators. The cultivators are those individuals who grow, harvest, package, and transport medical marijuana. They then take that medical marijuana and send it to processors. And processors are those who essentially process the marijuana into approved forms. And we'll talk some about that shortly, but basically one approved form of marijuana in Ohio is edibles. So they might take what they receive from a cultivator and make it into an edible so that it can then be sent to a dispensary. Now keep in mind that the cultivators and processors also have to submit all of their products to an independent testing laboratory, which is also licensed by the state, to make sure that there are no pesticides, mold, or anything that might impact the quality of marijuana that patients receive. So again, that's all the Department of Commerce, that's all their wheelhouse. Now the next step in the process is the dispensaries. And that's probably what you are more likely to hear about in the news. And of course, dispensaries are places where patients can go to gain access to medical marijuana products. But in order to gain access, patients have to work with physicians. So they're also, again, as I mentioned previously, they're also involved in this process. So patients, in order to receive medical marijuana, they have to receive a medical marijuana card from a physician. So what happens is they have to meet with a physician who has a certificate to recommend. So the next thing I'm going to talk about is how do physicians get the certificate to recommend. So for any physicians in Ohio who are interested in receiving a CTR, they have to have an active, unrestricted medical license. They also have to be registered with the Drug Enforcement Administration. And they also have to take a 2-hour course on medical marijuana. And once they receive their certificate to recommend, patients are then able to go to them to discuss medical marijuana. Now, essentially what the physician is doing in that process is diagnosing the patient or confirming a diagnosis. So as I mentioned, there are 21 approved conditions so far in Ohio. And so that physician is basically saying that yes, that patient has that particular condition and they're eligible for medical marijuana. So once that physician makes that determination, they then enter that patient's name and our caregiver, if they have one as well. They enter that into the patient and caregiver registry system. And essentially what that does is it kind of opens up an account, if you will, with the Board of Pharmacy, because again, they oversee the registry. And once that information is entered into the registry, the patient is then responsible for going into the registry and paying a fee. This would be an annual fee of $50. And then for caregivers, it's $25. And once that is approved, they would then receive their medical marijuana card from the Board of Pharmacy. So it's not until they receive that card that they're able to then go to one of the approved dispensaries in Ohio to actually receive their medical marijuana. And it's important to keep in mind that within these dispensaries, they're very secure. So only individuals who have medical marijuana cards and a state-issued ID are allowed inside of these facilities. So that is how medical marijuana gets into the hands of patients. Now, it's a long process. There can be a lot to navigate, and also keep in mind that there are also agencies, for example, that their job is to help patients navigate that process, because I mentioned there are a lot of steps there. So as I talked before about there being sort of this delay in the process, as you can see, there are many steps. And so you can kind of think about some of the things and struggles and challenges that the program and the state had along the way. But right now, that is the process of how it all works, from the cultivators into the hands of patients. Now, I want to talk some about a few updates related to the program and just kind of give you an overview of some particular facts, but also a few updates. So, one thing to keep in mind is that, again, there are 21 approved conditions as of today. And those conditions include things such as AIDS, cancer, post-traumatic stress disorder, etc. And again, the full link will be included below. But it's important to note that individuals can actually petition the State Medical Board of Ohio if they would like to add additional medical conditions to that list. So more recently, there actually was a round of petitions that was out here in Ohio, and one of those petitions was for the Bengals-Browns fans. So a petition was submitted essentially to have that added to the list of conditions for which people can receive medical marijuana, with the thought that the pain and suffering experienced by fans should be treated with medical marijuana. So we, of course, will hear about that petition along with the many others that were submitted. We'll hear about that within the coming months. But again, it just points to the openness of the process and the transparency there. So there are 21 conditions. There's also some rules around how marijuana can be consumed, and again, that's oversaw by the Board of Pharmacy. So in Ohio, you can consume medical marijuana through oils, edibles, tinctures, which are like alcohol-based cannabis extracts, lotions, patches, creams. However, it cannot be smoked. It can be vaporized in Ohio, but it can't be smoked as of now. In the same way that you can submit a petition to the board regarding the medical conditions, individuals can also submit petitions to the Board of Pharmacy if they would like to see additional methods of administration in Ohio for medical marijuana, such as smoking. So those are kind of the rules as of today. And I keep emphasizing as of today because things are changing, it seems like almost every day with the program. So here are just some numbers. Again, as I've shared, they're about to celebrate their year anniversary. And so as of today, there are over 78,000 patients registered with the Ohio Medical Marijuana Control Program. But unfortunately, only a little over 55,000 of those individuals have actually purchased product. And there have been several reasons cited for that, including the cost. So as you might imagine, because not all the dispensaries are open yet, and it's not covered by insurance, because again, remember, it's still illegal at the federal level. So that's a huge barrier for people. Also access, especially if there's not a dispensary in a local area around an individual who may want medical marijuana. But despite those barriers, as I noted, there are about 55,000 patients who have received medical marijuana in Ohio, and I imagine that that number will continue to grow. Now, from a physician standpoint, there are actually 590 physicians who have certificates to recommend in Ohio. But interestingly, only about half of those physicians have shared their contact information on the board website and appear on the locator map. And it's unclear why that's the case. And so that actually brings it back to the purpose of this channel, which again is emphasizing the importance of research. So we need additional research to understand, for example, why is it that physicians are perhaps hesitant maybe to provide that information. Or some of the other things that I mentioned about the program, such as the large number of patients that are registered, but yet the smaller number of patients that have actually received products. So a lot of my research around the medical marijuana control program falls into those domains. So I actually have a few studies brewing, so I'll make sure I'll keep you up to date with those particular studies. But I think that will about do it. Again, the program is about a year old now, and so of course this is just very preliminary information, preliminary data. There's a lot of things happening behind the scenes in a lot of different areas, so I'll make sure that at this time next year I'll also provide another update, and of course as things happen this year I'll continue to provide those updates as well. So if you have any questions, comments, thoughts, ideas for future videos, please include it in the comments below. I'll also include in the description box more information about the medical marijuana control program, such as the conditions, approved forms, etc. And we'll continue to do videos that talk specifically about the effectiveness of medical marijuana and kind of talk about some pros and cons, and especially when you think about THC, CBD, what works, what doesn't, and for what conditions. We'll discuss all of that together in future videos. But again, I'm open to new things, so please let me know. I'm anxious to hear from you. Also, make sure you like, in addition to commenting, subscribe, and hit that notification bell so that way when the next video comes out, you will be the first to know. And I look forward to seeing you next time when we will discuss all things weed.